everyone. Thank you so much for joining us today. Welcome to our webinar, You Have Medicare, What Do You Do Now? We're very excited to be hosting this event with Tyler Schmuckle. Today, we're going to discuss the important steps to take once you're on Medicare and the key items to review annually to ensure that your coverage continues to meet your needs. Our goal for the webinar today is to provide valuable information, first and foremost, answer your questions, and help you feel more confident as we enter the Medicare open enrollment season this fall. Our agenda for today, I've got a couple quick housekeeping announcements. Then we're going to do brief introductions, followed by Tyler's Medicare presentation, and then we'll open it up for a live Q&A session at the end. The couple housekeeping items that we have are, first, the webinar is being recorded. Second, if you have questions during the presentation, please submit them through the Q&A feature, which if you look in the Zoom window and you click more, then you can see there's a little box with a question mark, Q&A. You just open up that little window and then you can type in your questions there. And we will address those at the end and get through as many questions as possible. And then finally, if you just please keep yourself muted during the presentation so we can minimize the background noise. Now, I'd like to introduce our CWT team. You should be able to see everyone's pictures spotlighted so you can put some faces to names. Our advisors joining us today are Keith Brandt, Scott Stevens, Hannah Perez, Dylan Stafford, Nancy Tunigua, and my name is Megan Brandt. And then you might also recognize some of the familiar faces of our service team. We have a few members joining today as well. And next, I'd like to introduce our speaker, Tyler Schmuckle. He is a California native and has worked in the Medicare industry since 2013. He specializes in helping individuals navigate their Medicare options and make informed healthcare decisions. As an independent Medicare health plan broker, he represents more than 20 insurance providers and brings extensive knowledge of the Medicare landscape. Over the years, Tyler has helped hundreds of individuals evaluate their coverage and make confident Medicare decisions. We're very grateful to have you with us today, Tyler, and to share your expertise. With that, thanks for joining us, and I'll turn it over to you.
Yeah, thank you so much for having me. So yeah, I'm Tyler. I've been in the industry 13 years now. I exclusively do Medicare and represent a lot of companies. And come to find out, it's very, very confusing and it keeps me very busy. So I'm going to share my screen here. We have an agenda that we'll go over. And so today we're going to just look at the 2026 original Medicare, go over the Part B premiums and how they relate to income. Also to see if there's any opportunity to maybe appeal that with a life-changing event. We're going to look at the difference between Medigap and Medicare Advantage. On the Medicare Advantage side, we're going to look at both the HMO and PPO plans. We're going to look at some of the new changes coming up on the Part D side for prescriptions, and then just a few tips and tricks, what to look out for the next annual election period coming up in October. So let's start out with the companies I represent. These are just a few of them here. Most of the big names I represent. On the prescription side, they don't really let us broker out the plans anymore. So I use Medicare.gov and I put people in the best plan that works for them, regardless if I represent them or not. But these are some of the bigger companies that I represent. Going into the 2026 Medicare benefits. So what we're looking at here, this is just plain Medicare by itself. This shows why there's 150 different plans to choose from, because plain Medicare by itself, it's just not that great as far as insurance. It is very, very flexible. So if you're on traditional Medicare, you can go to pretty much any provider across the country, as long as they take insurance. The only one you're not going to be able to go to is Kaiser. They have their own HMO. They do not take original Medicare. But everybody else in San Diego County here, you can go Scripps, UCSD, Sharp, and jump around. The benefits here are broken up into two parts, Part A and Part B. The Part A services are the rare services. They're if you're admitted in the hospital or if you need skilled nursing. And so you can see here, if you're admitted and you're only in there one night, you're paying $1,736 before Medicare pays anything. Now, that's the same price if you're in there 60 nights. For the days 1 through 60, you have to meet that deductible before Medicare pays anything. That'll reset if you're out of the hospital for 60 days. So it could come up more than once a year. So that's a big ticket item there with Medicare. If you're in the hospital 60 days consecutively, more than 60 days consecutively, it goes to a daily copay. More than 90 days consecutively, it doubles, and it can get pretty expensive. So those are some of the Part A service out-of-pocket costs there. Skilled nursing, Medicare gives you up to 100 days at a skilled nursing facility. If you're in the hospital at least 3 days, that 100 days is per injury. And the first 20 are covered in full. And then they start charging you a couple $100 a day. So those are the Part A services. Part A has no premium as long as you paid into taxes for at least 10 years. Okay, most of your services are going to be on this side here, the Part B side. So if you're on traditional Medicare, you're using it, most of your services are going to be on the Part B side. This is anything outpatient, all your doctor's visits, lab work, x-rays, MRIs, outpatient surgeries, and so on. There is a small annual deductible on the Part B side. This year is $283. Once that's met, Medicare will cover 80% and you would pay 20%. The problem with this 20% is there's no limit to how much you can be charged. So if you go in there for a ton of services, the bills just keep going on forever. So that's one of the big gaps there. They also have these excess charges. You see some of the anesthesiologists will charge 15% more than what Medicare allows. That's called a Part B excess charge. It's less than 1% of doctors nationally that charge an excess charge. So not something you come across too often, but some of the Medigap plans cover that and some do not. Part B is the one with the premium. And so that's pretty much it for the Part A and Part B overview. We're going to jump into the Part B premium. So each year, let me make this a little bit bigger. They're going to pull your tax return to determine how much you owe for Part B. And so for 2026, they're looking at your 2024 tax return. They're looking at two line items, your adjusted gross income plus tax exempt interest, line 11 and line 2A. Together, they call that your modified adjusted gross income. Each year, this is reviewed. So come November, they're going to have everybody's 2025 tax return. They're going to reevaluate, and then they're going to send you a notice for 2027. And so if you're in the base rate here, 218 or less filing jointly, 109 or less as an individual, you're just paying the government the base rate of Medicare, 202.90 per month. This is what comes out of your Social Security each month if you're collecting. If not, they send you a bill for this. If you're in a higher bracket, then you're going to have something called an IRMA, income related monthly adjustment amount. And so there's 6 different brackets, and the IRMA just gets bigger and bigger. And so what happens here is people will go onto Medicare and retire. And they're looking back 2 years from when you're still working. If you retire and your income is going to go down a bracket or two, that opens up an opportunity to appeal this. Instead of waiting 2 years for it to catch up, you can appeal it now and use your 2026 income instead of your 2024. And so that's a little trick for those who are retiring or reducing their amount of work and having a big change of income. And instead of paying these huge amounts, you can get it down a little bit. And so you can appeal this throughout the year, and it always goes back to the first of the year if your Medicare is started in the first. And so sometimes people get pretty big reimbursement checks from the government just for that appeal. The appeal form is very simple. It's 3 pages. First page, name and social. All the work done is on page 2 here. And so these are the 8 different life-changing events. You have marriage, divorce, death of your spouse, work stoppage, work reduction, loss of income producing property, loss of pension income, and employer settlement payment. Most of the time, we're just appealing using work reduction or work stoppage. Some people think because they sell an investment home that they can use this. It doesn't work. They say that the house has to burn down. You have to lose it that way, not from the sale of the home. So most of the time we're appealing off of work reduction or work stoppage. But you're just going to fill in your 2026 estimated adjusted gross tax exempt interest And really, you don't need any proof. They're going to just adjust your premium, but they're going to hold on to it and compare it to your actual 2026 tax return. And so if you appeal it at 218 or less, let's say you're in one of these higher brackets and your income comes back at 220, you will get a bill from the government owing the difference here, where you should have been in this bracket, but you appealed in this bracket. So if anyone's in that situation, I highly recommend that you appeal it, because it usually goes through and saves you some money each month. So that is the Part B appeal form. Moving on, these are the main two routes here that you can choose from traditional Medicare. And this is where we're going to spend most of our time here. So you have two routes. It really comes down to full Cadillac PPO here on the original Medicare side, or you can opt into a Medicare Advantage plan, which are provider specific. A lot of HMOs and a couple PPOs. So on the original Medicare side, how it works is you stay on Part A and Part B as the primary insurance. So all the bills are going to the government first for the claim. Anything medically necessary will be approved. The only odd non-approval is a routine physical. You cannot get a routine physical exam. You have to call it a wellness exam. So if you're new to Medicare and you haven't really used it, do not book a routine physical, because Medicare will deny it. Nobody will want to pay for it. You'll get stuck with the bill. But anything approved here is going to be covered by one of these Medigaps. And so with all these out-of-pocket costs we went over, you can cover these with a secondary plan called a Medigap. These are the different Medigap plans. Most of you know because you're all on Medicare. The popular plans are going to be Plan F, Plan G, Plan N, and a high deductible version of F and G. So the Plan F was the Cadillac plan. If you're new to Medicare after January 1st of 2020, it's no longer offered. If your Part A is prior to that, then you may still have this plan. This Plan F covered every single out-of-pocket cost in traditional Medicare. They called it the all-you-can-eat buffet plan. Go to the doctor as many times as you want, and there's no bill. The government thought people were taking advantage, going in more than they needed, and so they got rid of it because of that. Now the top plan is the Plan G. The only difference in coverage is the Plan G doesn't cover the Part B deductible. So if you go back to this chart here, you can see Part B deductible is only $283, and that's an annual calendar year deductible. So once that's met one time on the Plan G, you have full coverage. So this plan has been very, very popular. The Plan N has a $20 copay after the deductible is met. It also doesn't cover the Part B excess charge. But this one, for people who don't utilize the plan as much or don't go to the doctor as much, they like the Plan N. It's kind of a middle plan. And then you have the people who are super healthy and really don't plan on going to the doctor, but still want flexibility. They can purchase a high deductible Plan F or Plan G. What that does is it keeps you put on all of these out-of-pocket costs here, but it just puts a cap at $2,950. And so if you use it, you're going to get some bills on that plan, but you have that stop loss at $2,950. None of the Medigap plans have prescriptions included. And so in California, there's 12 different prescription drug plans. And we're going to go dive a little bit deeper into those after I talk about Medicare Advantage. But this route here, the original Medicare route, is the Cadillac PPO that will allow you to go to pretty much any doctor with no authorizations, no referrals, very, very easy access. And as a broker, I like this because I don't get as many complaints. So these are my favorite type of plans. On the Medicare Advantage side, when you go into a Medicare Advantage plan, you no longer are using your Part A and Part B as your insurance. Instead, the government pays the Medicare Advantage company to insure you. And so the insurance company on that Medicare Advantage plan gets to set the rules. And so they will make up their network of doctors. They will have their own copays for different light item services. And most of them include a prescription drug plan. The benefit of going Medicare Advantage is there's usually no premium in addition to the Part B premium for these types of plans. where you're going to pay a couple $100 a month for one of these Medigap plans. These Medicare Advantage plans, a lot of them are zero premium. And so what I don't like about the Medicare Advantage plans, especially if you're going with an HMO, is that in San Diego, especially, there's not a lot of doctors that you can see. So Scripps Clinic, Scripps Coastal, they pulled out. They don't take any Medicare Advantage as in network. UCSD this year, they just pulled out. They have one plan that will allow you to get to their specialists, but not their primary care. And the biggest problem with the Medicare Advantage plan is that all your services require authorization, and it enables the insurance company to kind of dictate what they want to cover and whatnot. So if you want to get an MRI, a lot of the times they won't authorize. You'll have to get an X-ray. If the X-ray doesn't show anything, then maybe you'll go to PT for 6 weeks. And if it still doesn't get better, then maybe they'll give you the MRI. And so it just kind of, takes a lot of time to get things done on a Medicare Advantage plan. Now, there have been a few new additions to Medicare Advantage, and they have these Medicare Advantage PPO plans. And so when Scripps pulled out from the Medicare Advantage HMO side, this was January, I think, 2024, there was a lot of these PPO plans that were created. So I'm going to give you just a quick overview of one of the popular plans here so you can see. This is the Humana Choice San Diego PPO. And I want to show you this plan because it still has a network and it works a lot differently than other plans. You're going to see two different benefits, in network and out of network. And so if you go out of network, you're going to pay a lot more. You're also going to pay up to a higher maximum out of pocket, $8,900. This is the big reason I don't like these PPO plans. There may be people on them and they do work okay if you're using them for preventive services. But if it's something major, you're going to expect to pay this $8,900. What I really don't like about this PPO is in the evidence of coverage. If we go down here, you see this has to move. Get this out of the way. I'm going to go down here. So this talks about the accessing out-of-network providers. And so let's see right here. How do you get care from out-of-network providers? So as a member of our plan, you could choose to get care from out-of-network providers. However, providers that don't contract with us are under no obligation to treat you. So even though it is a PPO, the out-of-network doctor still has to accept you. And we've seen doctors at Scripps and doctors at UCSD not accept some of these PPO plans. Also, right here, you do not need a referral or prior authorization when you get care from out-of-network providers. However, before getting services from out-of-network providers, ask for a pre-visit coverage decision to confirm that the services you get are covered and medically necessary. If not, then they might not cover the service. And so you still kind of need a prior authorization, even though it's a PPO and you're seeing an out-of-network doctor. So the access to care is something that, it's not certain on this type of PPO, where it would be certain if you go with original Medicare. So I just kind of wanted to make that clear because that's something that people don't realize. This plan might show that you can go to a primary care doctor for a $0 copay out of network, but there's no guarantee you can get to that doctor because they don't have to accept the plan. So that's one of the issues there on the Medicare Advantage PPO plan. Okay, so moving along, we discussed the Medigap plans. So these plans here are standardized plans. You can get them from 20 different companies, and they all work exactly the same. The reason they work the same is because Part A and Part B is the primary insurance, and they're the ones who are doing all the claims. Once they approve it, it's black and white to the Medigap company. They are not going to say, yes, we're covering this, no, we're not covering that. That's all done by Medicare. And so every company has different rates, and they all go up at different rates. And so if you've seen big rate increases the last 2 or 3 years, you are able to review this around your birthday. And sometimes there's $100 a month savings, same exact plan, just because your company you're with now is going way up. So it's a good thing to review every couple of years, just to make sure you're not overpaying on these Medigap plans. Um, Instead of these Medicare Advantage PPOs, I like the high deductible plan. If you want to keep the premiums down, when you're in your 60s, you can get a high deductible Medigap plan for $50, $60 a month. And it just gives you so much more flexibility with the access to care. Okay, so that's the Medigap. Let's move into the prescription drug plans. So the prescription drug plans, these plans are 1 year contracts. I know a lot of you are currently on traditional Medicare with a Medigap and a Part D plan. These plans, they drive me crazy each year because they're able to change a lot. So they can change what's covered. They can change the premium. They can change which tier your drug is covered in, which dictates the copay. So we're going to take a look at the 2026 plans. I'm going to go to Medicare.gov, and we're going to take a look at these together here. Okay, so this is from Medicare.gov. This is showing the 12 plans offered in California in order based on premium. So this plan has been very popular this year. It was Cigna. They just rebranded to HealthSpring. This is a $0 a month plan. It's a free prescription drug plan. So for people who aren't taking many medications, don't plan to use it, this is a great placeholder. If you don't have a prescription drug plan, you'll be penalized. So why not just get one that's free? Also, this plan has a very good tier 3 and tier 4 co-insurance. You see sometimes that there's a prescription that's not covered on the formulary or on the covered drug list. And if it's authorized, they do a non-formulary exception. They'll put it in this tier 4, this non-preferred drug. So at 29%, that's actually one of the lower tier 4 copays or co-insurances. And so this plan is very popular. Also, with the new rules, there's a new cap on the total out of pocket, and it doesn't include the premium. So the most you can spend out of pocket this year is $2,100 at the pharmacy. And so if you're taking very expensive medications, this plan will only cost you $2,100. Where if you go with a very expensive plan, let's say you're paying $103 a month, you would have to pay that premium in addition to the $2,100 at the pharmacy. And so with these new rules, it started in 2025 with the Inflation Reduction Act. For those of you who have been in Medicare longer than a few years and are taking expensive medication, you may have come across something called the donut hole. And so they used to have this gap in coverage. It was the donut hole. And so your insurance would be working okay. And then all of a sudden you'd hit a limit and your insurance wouldn't work well at all. And it would be really hard to get out of the donut. And so they got rid of it January 1st of 2025 with the Inflation Reduction Act. And there was a $2,000 cap last year and a $2,100 cap this year. For 2027, the numbers just came out. It's going to be a $2,400 cap for next year. So some big news that just came out a couple weeks ago was because of the transition with the Inflation Reduction Act, the government was subsidizing these standalone drug plans. And so I think it was something around $10 billion over the 2 years. They were helping out these drug plans with the transition because of this new cap and how it could affect their out-of-pocket costs. Well, that is going away as of January 1, 2027. So we are anticipating these plans to change quite a bit next year. These co-insurances you see here could be going up. The premiums could be fluctuating quite a bit. They did put a $50 cap on the increase in premium. So we know that the cheapest plan, it's not going to be more than $50, but there could be some pretty high increases in premium next year. And so that is something that you're going to want to look out for going into this annual election period. Every September, you're going to get your annual notice of change. And so that's going to tell you exactly what's happening to your current plan for 2027. They're going to tell you the premium. They're going to tell you if any of your current medications are changing tiers or dropping off the formulary. So definitely keep an eye out for that, because that's a great notice. And a lot of times it's customized to you and your prescriptions. So definitely keep an eye out for that. There's also a new GLP-1 bridge program. And so some of these plans are covering GLP-1s, but only for type 2 diabetes or sleep apnea. This new GLP-1 bridge program will allow you to access these medications for weight loss. And so I think I have a slide here. And so these are the qualifications for the bridge program. It's off a body mass index, 35 or higher, or 30 or higher with a few different conditions, or 27 and higher with these conditions here. So if you qualify because of type 2 diabetes or for sleep apnea, you cannot qualify for the bridge program. If you don't have type 2 diabetes or sleep apnea and you want a GLP-1, you can get it for $50. So they're giving out Wegovy, the other ones, Zepbound, and Foundayo. So those are the three medications on the bridge program. Initially, it was just going to be just half of this year through December 31st, 2026, but they've extended it all the way through the end of next year. So I know a lot of people were getting these through Lilly and paying $300-$400 a month. So this would definitely help getting it through the GLP-1 bridge program, because it's only going to be a $50 copay. The $50 does not go towards your $2,100 cap. So it's separate. So that's pretty much all I have. Again, what to look out for, especially if you're on traditional Medicare, is going to be on the prescription side. These Medigap plans, they always go up each year. They go up twice. They go up once for your age, and then they go up for claims. So they kind of take a look at all their claims paid out, and they go up a percentage. And so they're always going up each year, but the coverage stays the same. So you're going to have good coverage. The drug plans, it can go up and get worse. The coverage could get worse. So that is something definitely to look out for. Also, if you're on a Medicare Advantage plan, those are also one-year contracts. And so you definitely need to look at the annual notice of change. If you're on one of the PPO plans on the Medicare Advantage side, and you're using an in-network doctor, you want to make sure that contract remains as an in-network doctor, because those contracts will fluctuate year to year. So just a couple tips and tricks there. But that's about all I have.
Great. Thank you very much, Tyler. Real quick, before we get into some questions, we do have a few questions in the Q&A room. Anyone that didn't hear at the very beginning, or maybe popped in a tad late, there is a Q&A box down below. If you click on the more with the three dots in it and you see a little question mark, that's where you can submit questions. Also, this is being recorded, and we will send it out after we are all done. While you're right there on the drug packages and programs there, Tyler, one of the last questions was, but I want to touch on it real quick. What does the 29% co-insurance mean on the drug coverage, the HealthSpring one that you said was popular?
Yeah. So this plan here is the HealthSpring plan. It has a deductible. So if we put a few medications in here, you know what? Let me pull up something here. So let's put in a couple medications, because this will help. So if we put in like Xarelto, it's an expensive one. We can put in let's put in Ozempic. Okay, continue. continue. And then let's put in just a couple more of a stat. And let's put in a little start. Okay, so let's go to the plans now. We can pick a few pharmacies. And so this plan's in order of total out of pocket. This WellCare plan is also a very popular one. This one's only $5.70 a month. So if we go here, I want to show you the tiers. So this is the important thing here. It doesn't matter which plan. This plan, their non-preferred is 40%, where the other one was 29. But the tiers are what important here. So this has two tier ones, a tier 6, and a tier 3. So with this particular plan, there is a deductible of $615, and it is applied to tier 3 here or above. And so if you look at pharmacy costs here, for the tier 1s, you're going to get them for free. For the Ozempic, this one is pretty wild. This year, I don't know if anyone's on this plan and using it for the GLP-1s, but this WellCare plan had 4 medications in their new tier 6, and it's an $11 copay. It was Ozempic, it was Ribelsis, it was Monjaro, and Trulicity. But you can see here, after the deductible is met, it goes way down in cost here to $11 a month, which is a pretty good deal. I imagine this is probably going to be going away next year. If I had a tier 4 in here, I could show you, but I don't, but I can explain it. So once the deductible is met, you're going to pay 40% of the retail price. And so if that Ozempic was a tier 4, you would be paying 40% of this $943. The Xarelto is a tier 3, so you're paying 25% of the 207 per month. And so the tier kind of dictates what you're going to pay. And so each year, the prescription drug plans, they can put these medications in whatever tier they want. And so like this new tier 6 they created. So they're the only plan with a tier 6. And it's probably going away. But other plans, if we go look at the cost. The next one is the Humana. Let's go to that HealthSpring plan, right here, the $0 plan. So they have Ozempic and Xarelto in a tier 3, which means you're paying 25%. This plan isn't coming up as one of the top plans for this drug list because Ozempic has a very high retail cost. Even after the deductible, you're paying $245 a month for that, where the WellCare plan had it for $11. And so these plans, they're very tricky because each individual's medication list will dictate which plan is best for them. There's not one plan that covers everything well. And so some medications are better with one plan than another. And so these plans are very, very tricky. And this is what keeps me very busy during the open enrollment each year, because I do just like I did here. I plug in the medications and we just take a look at all the plans and see. And so hopefully I answered the question about this 29%, but that is a tier 4 co-insurance. Once the deductible is met, you would pay the cost after deductible amount, and that would be 29%.
Okay, we'll stay on the prescription drug plans. Another question, can you opt out of, or would it make sense to opt out of the prescription drug plan and just use GoodRx?
So I wouldn't recommend that, because if you go more than 63 days without a prescription drug plan and you ever decide to purchase one down the road, there's going to be a penalty that you're going to pay every single month as long as you're on that plan for the rest of your life. So if there's an offering of $0, you might as well take that plan. Next year, we might not see that. But yes, GoodRx has pretty good discounts. There are some medications, though, that they don't have good rates on. Also, if you're using GoodRx, you're not going to have that $2,100 cap. So I wouldn't recommend that just because of the penalty. And then it's an unknown with GoodRx with the drug costs and their prices. You could run into a medication that's very, very expensive and you're not going to have a cap like you would on these Part D plans for Medicare.
Got it. Can you switch from a Medicare Advantage plan to a supplemental plan and vice versa?
So yeah, that's a good question. So these Medigap plans, they do require health underwriting. So if you're not in your new to Medicare initial enrollment, and you're coming off a Medicare Advantage plan, you may have to qualify. And if you have a pre-existing condition, they may not approve you. There are some funny little tricks though. So if you're on a Medicare Advantage plan and any of these co-payments here, all these line item co-payments, if any of them go up by 15% or more, then they allow you to go into a Medigap plan, that same company's plan if they offer one, with no health questions. So if you're on this Humana PPO and the $0 out of network copay goes to $5, then you can go into a Medigap plan, Humana's Medigap plan, without any health questions at all. With the guaranteed issue, they call that a guaranteed issue, you can only go into plan F and plan N. For some reason, they don't let you go to plan G. But yes, you could get into it without health questions. If there's no change in benefit, then you might be stuck. If you can't qualify through health questions, then it might be difficult. If you move out of the county, out of San Diego County, let's say you just move up to Riverside County, then you will be automatically terminated from this Medicare Advantage plan, and you could purchase a Medigap plan in that new county and still use it in San Diego. So that's another little trick. If you have another property outside of the county, you could use the address change, and that's a way to get into Medigap without answering health questions.
Great. Are there any pre-existing condition exclusions from changing either the drug coverage or the Medicare Advantage program?
No health questions on Medicare Advantage or drugs. Only on the Medigap side, you'll see the health questions.
All right. Can you explain the California birthday rule?
Yeah, so the California birthday rule, it allows you to go from like to like Medigap plan or down in coverage, not up. The window begins 30 days before your birthday and goes 60 days after. And so you can shop out plans. If you're on a plan G, you can look at other companies' plan Gs, and it bypasses all the health questions because it's a guarantee issue. So they let you change companies around your birthday very easily if you're keeping the coverage the same or going down.
Great. Got another. Can you talk about rules for areas other than California? Are they different? And if they are, how are they?
Yeah. So each state has their own rule with these Medigap plans. Some states, they let you change throughout the year. Some states, they don't have a birthday rule, or they don't have any way of changing unless you're healthy. So I know Texas and Arizona, they don't have the birthday rule. Nevada has the birthday rule. Oregon lets you change like any month you want. So it really depends it depends on which state you're in.
All right. Anybody else funnel any more questions in? Any other kind of last minute tips and tricks, or what is the actual period? I think you had it on your agenda.
Yeah, October 15th through December 7th. That is the annual election period. Any change made during that time will start January 1st of 2027.
Okay. Anything special either looking out for this year or pay attention to every year when they're going through the election period?
Yeah. So the prescriptions is the big one. If everyone wants to take a look, October 1st is when the plans first come out, and Medicare.gov is a great resource. And so you could just go to the homepage here after October 1st, find health and drug plans. If you have a login, you can put in your prescription list and it'll save it in here for you. If you don't, you can just go here. You don't have an account, put in your zip code. You're looking at the Part D plan. or Medicare Advantage if you're on Medicare Advantage. And you're not going to get any help from any Medicaid or any of that. So it's down here. And then you can put in your medications. And come October 1st, there'll be a 2026 and 2027 toggle. So you can look at both years. But everyone can do this themselves. It's a great tool. You can plug in your prescriptions and kind of get an idea of what's going to happen in 2027. So I would recommend everyone look at that. If someone's having issues or everything seems really expensive or they're having trouble, I don't mind helping out. This is really all I do. And so if someone's having issues, let me know and I can take a look at it for you and figure out which plan's best.
Okay. Doesn't look like we have any more last minute questions funneling in. Any live, spoke too soon. Are you seeing Medigap monthly fees going up 20+%? Just saw this person just saw an increase of 25%. Are you seeing similar?
Yeah, they go up twice a year. So they're going to go up for your age about $10, and then they go up a percentage based on claims. And so this year especially, we've seen a lot of the companies increase 12, 15, 16%. When you add in the age increase, it does get somewhere around 20% or more. Prices are just going up. I've seen a lot of companies try to come in lower and they just can't afford it. And they end up pulling their plan and leaving town. And so, it kind of is what it is. There are some companies that go up a lot faster than others, just looking at the long-term rates. And so that birthday window is a great time to review that because there could be some savings if you're in a company that's going way up, as you get older. So.
And so as far as you and the kind of counseling that you can give, what's the advantage to working with somebody like you as opposed to somebody trying to do it themselves?
Yeah. Well, first off, we don't charge any fees. And so there's no price to use my services. I've been doing it a long time. I've seen, what's happened to a lot of these companies that come in really low and they get high. And then I've seen the more stable companies that just kind of are steady each year. So just the experience. Yeah, I represent a lot of the plans. So if you want to see what I have to offer, I have no problem showing you.
Okay. And I do have a question in here providing slides and how to get in contact with Tyler. So we will have the recording go out, so you'll be able to get copies of that when we do the sign off info here. If there's no other questions, Tyler, thank you again for taking the time to kind of share your expertise and insights and tips and tricks with our clients today. We really appreciate your willingness to help out and your expertise. I know Medicare is a minutia and constantly changing, so it's not easy to stay on top of. If anybody would like to learn more or connect with you or additional educational resources that you provide, where's the best place for them to find your work and get in touch?
So you can go to my website. We can have Keith send it out to everyone attending, but it's schmuckleinsurance.agency. I can send it to Keith because it's kind of hard to spell. I have a funny last name, schmuckleinsurance.agency. So this is my little website here. There is a little contact form here. So if you do want to get in touch with me, you can just send me a little message here and it comes to my email. You could also call me, text me, email me. I don't mind talking on the phone. So I think that's best. But if you want to use this, you can. So yeah, Keith should have all that information.
Okay, I've got a few thank yous in the question and answer box, but no more questions. So thank you again, Tyler.
My pleasure.
We sincerely appreciate your partnership and expertise.
Pleasure being here. Thank you so much for having me.